The idea of the study was to try to personalise information about the risks of non-steroidal anti-inflammatory drugs, so things like ibuprofen and diclofenac, which are widely taken by many people around the world. And the particular drugs we were studying, ibuprofen and diclofenac, were used in very high doses. So we're talking particularly about high doses of these drugs. We're not talking about the low doses that are typically used if you sprain your ankle and just have to take Nurofen for a few days. In general, the people who are going to be most commonly affected by this will be people with rheumatoid arthritis or osteoarthritis, but there are other conditions that cause joint pain where patients might well be taking a high dose of one of these drugs. We're talking about really low risks. The extra risk of a heart attack is very small, but if they are worried, they could go and talk to their GP about it, and they can consider whether the risks, which are real but small, are worth it for them, because many of these patients will, because they take these drugs, be able to go about their daily lives and be able to function normally as a human being. If they don't take anything to reduce the pain and swelling, they may not be able to do that. So it's a judgment for each individual person about whether the tiny risks are worth it for them, for the extra quality of life that they get. I think the best thing for people who are worried about these risks is to talk to their own doctor, because the alternative drugs for people who have pain and swelling and really struggle with their daily lives because of that, the alternatives to that are themselves associated with side effects. And so it's really something that a doctor has to discuss with their own patient about the alternatives. There are many alternatives, and they are all potentially associated with side effects.